Hi, everyone. This is Christy Keith from Fear Free. I'm a senior communications strategist, and I'm very happy to introduce you to Fear Free founder, Dr. Marty Becker. He's going to be speaking today with Dr. Boaz Man, who is a Ross University College of Veterinary Medicine alumni ambassador. They're going to be talking about the future of veterinary medicine through our veterinary students and the new relationship between Fear Free and Ross to implement Fear Free as part of their veterinary requirements for their vet students. And this is a really exciting thing for Fear Free. Ross actually graduates more veterinary students than any other college veterinary school in the United States. So we're very, very excited to have this new partnership. So that said, I am going to turn this. Oh, I just wanted to mention that Dr. Mann received his doctorate of veterinary medicine from Ross in 2004 after completing clinical training at Oklahoma State University. And he's the medical director and owner of Boca Midtowne Animal Hospital in Boca Raton, Florida, which is a Fear Free certified practice, as you can see from all his Fear Free ornamentation there. And we also want you to know that Elvis is in the building along with his friend Millie, and you'll be getting to meet them a little bit as well. So I'm going to turn this over to you now, Marty.
Hey, thank you, Christy. By the way, Christy is pretty humble, the senior communications strategist. Christy and I have worked together for decades on syndicated columns and books and TV appearances. So whenever I was stuck on anything, I call her Dr. Christy Keith, even though she's not a veterinarian. She knows more than any veterinarian that I know of. So also had a health scare recently. We won't go into details, but if any of those the type that have faith would appreciate lifting Christy up in prayer. We're glad to see her coming up on the sunshine side of the mountain again. I always wanted to say he's my right-hand man, and it works here with Boaz Man. A new friend that I've met over a colleague, but a new friend that I've met over the last couple of years, and you've become very close. And great sense of humor, great family. Like Christy said in the introduction, practices down in Boca Raton, Florida. You can probably tell by his tan. He was out on the boat this weekend. You can probably tell by my lack of the tan that I'm stuck in a hotel room in northern Idaho. But Boaz, thanks for being on this event. And one of the things that there's an old saying, tell me I'll forget, show me I may remember, involve me and I'll understand. And when it comes to Fear Free, there's people that, there's over 100,000 people Fear Free certified. They go through level 1, they're Fear Free certified. And you not only have taken in everything we had to offer in Fear Free, but you've actually advanced, and I have learned from you, and Fear Free has learned from you. So I want to come back to Ross in just a minute, but tell me why you got involved with Fear Free.
Thank you, Dr. Marty, for having me. It's an honor and a privilege to be part of Fear Free. And, we as veterinarians have an oath to provide the best care for pets, and that's always been ingrained in my blood since I was a kid, because, obviously the human animal bond is what brings us all, to this profession to care for pets. And for so many years, we did everything possible to help pets, medically speaking, making diagnosis and treatments. And then it all came to me like as a flash of lightning when I did my first Fear Free certification. And I realized that, the emotional well-being makes such a big difference. And that's, the human animal bond is so important. And that's why we all have the privilege to do what we do. And by interacting with pets in a thoughtful and meaningful way, so much change has taken place in my practice. I know for other Fear-Free people, and my thing has been to show, what we're doing to try to make it better for pets, to get the pets into the vet is the most important thing that we can do as vets. And, making that a good experience helps that process happen. If people and their pets are coming into the vet not having a good experience, the pets are anxious, they're fearful, they're not going to come back, for their regular checkups, maybe once a year or maybe twice a year. So we're missing an opportunity to see those pets, and then we're not doing the best thing for those pets. So that's why it became so important for me to become involved in a bigger way.
Boaz, it's really interesting you say that, because Christy and I we worked together for decades, and Fear Free started when I went to a lecture in 2009, and then we were working on proof of concept for 5 years. It formally launched as an online education program in 2016. But I still remember, Christy, this was shortly after the 2016 election. So I remember Christy was really sad, and all of a sudden one day she called me and she was like euphoric, and I thought, man, whatever medication you're on, I want some of that stuff, because I would have been depressed at the time too. Christy had taken her pet to a Fear Free veterinarian, and she knew my excitement about it. She was part of building it, but it wasn't until she went to a Fear Free veterinarian and they couldn't get her dog to leave the exam room. She had to pack it out to the car, and Christy called me from the car, and I still remember the words she said. I always felt like I've been hurting my pets by trying to help them. And that stuck with me, because if, you've got Elvis there, and we're going to talk about Elvis, a little cute story in a moment, but there's only one greatest pet in the world, and every family has him or her. And if you feel like you're hurting them by trying to help them, you're tempted to go, I'll just go on the internet, or we'll just see if they get better. Or I'll listen to that pet store employee that talks about super premium food that's going to change everything. So how has it directly helped your patients? Because you look at medicine, right? People bring a sick or injured pet in and expect you to be able to either prevent problems or fix an injury or illness. How has it helped in your patient care?
I think that the most important thing is being able to really figure out what's going on with the pet. And the only way to do that is with a thorough exam. And these dogs or cats that are coming in fearful and anxious, basically there was no way for a thorough exam to happen, because we weren't really trained to identify the body language that told us that they were fearful and anxious. We didn't know how to interpret that and to act on it. And some of the things that Fear Free brought to my attention were very common sense. Like, for example, this right here in my hand, the Easy Cheese, a paycheck and a positive reward to a dog. Elvis is looking at it because, he already knows what it is. But, just giving them a sense of feeling good when they're here. And like you said, they want to come back when they remember, hey, when I went to that place, the banks used to do it years and years ago. My mom would always tell me, I got to take them to the bank because they always give them a cookie. They would shoot it through that little thing in the bank, and the dog would eat a cookie. And they remembered every time to go to the bank that they would get a reward. So it's just simple concepts that are easy to do and implement, and such a help to make it a better experience. And if you're not able to, for example, look in the mouth of a dog who is suffering from advanced and painful infection in the mouth because they're fearful, then you've never addressed, a big health concern for that pet. And a lot of vets may have missed it if, they weren't able to do an oral exam because the dog was so anxious. Same thing goes, with otitis. If you're looking at a dog who's fearful and anxious while they're getting something like Easy Cheese or whatever their favorite treat is, it's like a 9 out of 10. Almost every exam is done when they're busy doing something else, and when they're happy and occupied, you can get the exam done. Whereas you don't need the sedation. You don't put that extra strain on the cost of, sedation and all the things that are done, the warm blanket to keep them nice and cozy, the gentle talking. And these are not things that, Fear Free invented, but somebody needed to take all the things and all these professionals put all these ideas together and put them in a course, which you've done brilliantly. And so a lot to be said for all the things that have been incorporated.
Let me add a little bit to that. What you're talking about is the distraction technique. And Boaz, I'm sure we're going to get to Ross in just a second, but we were taught restraint. Restraint was designed to protect people. So, when you look at what Fear Free is considered approach, the touch gradient gentle control is designed to protect the pet. And actually you get a better exam, a more thorough exam with fewer injuries if you do it. We have a little slogan called putting the treat into treatment. And what you talked about, what happened at the bank, pets, or if they go to Starbucks and get their little I can't remember what they call it, puppuccino, I think, with a little whipped cream. They know every place that they get a treat, just like my kids used to know every place that there was a play area. Steve Ettinger, for those friends of ours or colleagues of ours or pre-vets that are out there, Steve Ettinger is probably the most famous veterinarian in the world because he's a co-editor of the textbook of Veterinary Internal Medicine, which is kind of our Bible. He has served as Fear Free's chief veterinary officer. And we were looking at the proof because, good medicine is the cornerstone of, physical well-being, emotional well-being. That's what Fear Free does. The vital signs, temperature, pulse, respiration. Often if a pet is shivering, just like we shiver if it's cold to raise their temperature up, they'll shiver because they're fearful and it'll raise their body temperature up. So instead of 101.5, it might be 103.5, and we wrote it down as artifice. If the pet was calm and the temperature was higher, it might be fever. Same thing with the heart rate. If the heart rate is higher, is it hyperthyroidism and not just the fact that they have fear, anxiety, and stress? The blood chemistries are more normal. When a pet is in the fight or flight response, the spleen squeezes out, puts red blood cells out to carry more oxygen, white blood cells out to fight infection, and blood glucose. What if blood glucose was increased in your blood chemistries on a calm pet? Might be pre-diabetic. And also, you mentioned this about pets. They'll have, periodontitis or otitis or arthritis. Let's just take arthritis. They're limping at home. They cried out in pain. They come into the vet clinic and they're running like a canine Usain Bolt because of all that cortisol that's in there. If they're calm and have low levels of fear, anxiety, and stress, you can actually reproduce the injury. Let's go to Ross. Like one of the things about you that I've got to know, you have tenacity. One of the most determined. Your dreams have deadlines, and I admire that in you because I'm the same way. And boy, you were determined. You're a very proud Ross graduate, a very proud Ross alumni. I know you do a lot of things. I think you take almost every opportunity I've seen to promote them. And for those of you, you can tell a little bit about where Ross is, but it's not all puppies and kittens and farting rainbows out down there on the beach down there. Tell me why you went to Ross. Tell me about where Ross is and why this place is so important in veterinary medicine.
Sure. I mean, right now, in this country, there is what is known as a shortage of veterinarians for the pets and the pet parents. And Ross University is located in St. Kitts in the West Indies, and it is now an accredited veterinary school by the American Veterinary Medical Association, which is huge because when I went, it was not, and we had to do all kinds of extra foreign licensing tests, after we graduated to be able to practice in the States. But now, because Ross has been around so long, because there are a lot of vet schools outside the U.S., but because of their reputation and their relationships with the U.S. vet schools, just for an example, when I was at Ross, there were, I think, around 15 or 16 vet schools where you would spend your last year in vet school to do your clinical rotations. Now I think it's like 30 something. And all these vet schools have learned that the Ross students are determined veterinarians who want to provide the best care. And they, much like myself, were fortunate to be with veterinarians who were dedicated only to teaching, who had years of experience from all over the world, who wanted to help veterinarians with their dreams. Like myself, since I was a kid, you asked me why I chose Ross. I knew that's what I wanted to do. My path there, was chosen because it was very challenging, as it still is. There's only, I think 30 schools now, or maybe a little bit more in the U.S. And if you compare that to medical schools, there's, 300 or so. So, there's so many people wanting to be veterinarians, so many people wanting to provide treatment and medical care for pets, and there's just not enough facilities to accommodate those needs. So Ross graduates veterinarians they take veterinarians 3 times a year, so it's a continual enrollment. So as opposed to the United States, they have 3 semesters a year. They don't have that long summer break. It's a very intense course and training of all the same schools, all the same types of facilities. Their facilities are unbelievable now. I went there recently on a cruise, and now they have a dorm there, and they have all these extra auditoriums that they built. And they're really on the top of technology. And, there is no reason for anyone who wants to be a veterinarian and who's determined and who has made some progress with their studies to not be able to, complete their dream. And that was always my dream. So that's why I chose Ross, and that's how I found out about it. I'm very much an ambassador, and I help to speak to the alumni who go to Ross to show them, what you can achieve through Ross. And, being a veterinarian is very, much of my core.
One of the things I admire about you, Dr. Mann, too, is I know you were dyslexic and had some struggles. And so it wasn't all an easy course for you, but I know you're also open about that. I'm open about my depression. I think that's important for people. And although you got a Boca Raton tan, we wouldn't describe you as a person of color. One of the things that I am really, what would I say, that I think is really significant about Ross is they have about 30% people of color in the curriculum versus about 20% in other veterinary schools nationwide. So there's a saying, this is not mine, you can't be it if you can't see it. And
right.
Another reason why we're working with another group called, if you go to vetscoop.com, you'll see a group of veterinarians, 2/3 are women, which more reflects what veterinary medicine is like today. Matter of fact, there's about 60% female veterinarians in the United States. About 80% of the veterinary students are female now. But we have, I think, 5 Black, 4 Hispanic, 3 Asian, 1 Native American, 2 people that are openly LGBTQ. We need more people to see people that look like them. We need more people to apply to veterinary school in general, and we want more minorities specifically. When you talking to Elvis there's dogs that have expensive tastes. And one of the things that I tell my clients, and I tell people in my syndicated column or things, is that the biggest waste of money in pet care is super premium foods. And I joke that, you get this stuff, Farmer's Dog or Solid Gold or these things. And I was introduced for years as America's veterinarian. I'm still introduced that way. And of course, people would love me to feed their foods. I buy my own food, either at a feed store or online, and it's not super premium foods, but I joke about a dog taking a $5 poop, right? You go ahead and buy that stuff and let your dog take a $5 poop. Well, Elvis, he takes expensive taste to a whole nother level, and something that in fact became kind of a viral national story.
Yeah. So, as far as Elvis goes, and I just wanted to kind of correct on something you said about dyslexia. I actually have ADD, and I've been talking about that in the past. And, I wanted to also let people know who are considering vet school who have ADD or other such potential challenges that it's doable to get through programs like this. And thankfully, Ross helped me get through what I needed to get through with that aspect. But Elvis here, he decided to put everything in his mouth, including my wife's diamond earring. And she came to me and said to me, I always put my earrings there on the bed stand, and I just saw Elvis over there, and I found one of them under the bed. And I know he ate it. I said, okay, happy wife, happy life. I'll go ahead and take the x-ray and make sure that she knows it's not in there. And sure enough, it was sitting right there staring at us, magnified on the x-rays. And so, I, being the vet that I am, knew I could get him to vomit it out. And that happened, and got it all on video because everything has to be a story now on social media. And the local news said, wow, that's a great story. Can you bring him in? I said, well, yeah, let me see if I can get the owner's permission. And he's my dog. Yeah, sure. I'll go ahead and come on in. And we did a great story on him and how important it is, to keep things like that out of your pet's mouth and what to do when that happens. And so, funny thing, he is a Boca dog, and expensive taste happened to be my wife's diamond earring. We don't know why he swallowed it, but he did, and it's out. And thankfully that's over.
I got to admit, Elvis is adorable. And I've seen a dog shirt before that says, caution, I can't hold my liquor. And I have a feeling you need one of those shirts for Elvis because
yes.
He reminds me of like Phyllis Diller's hair. That's this, maybe yes. I'm dating myself, but this comedian with this crazy, crazy fuzzy hair.
Yeah.
I want to ask you two final questions. One is about, you are amazing at social media. It's one of the things that I'm not jealous of you. I cheer for you, but I watch how you create these stories, and why is that important? Because you have an audience outside even Boca Raton, but if you look at your clientele, that's how millennials and younger tend to communicate. And tell me how you got into that and why you think that's important for veterinary care.
Yeah, so the main thing that I wanted to share with people, and I still want to share with people, is people don't know what we do. People don't know how we do it. People don't know what these tests mean when we run them on pets. And so my goal is to show the type of care that we can provide and the teams that help us provide that care for the pet, and showing the real pet stories like I have in the past, where we had a pet that came in sick, nobody knew what was going on, we figured it out, we got the pet better. That has some meaningful implication, and if people are with their pets not going to the vet, they're missing things, and it's so important for us to have a relationship with the pet parents. And the pet parents frankly love to have their pets on TV, and they love to share their stories, and they love to see that they got better and how they got better. And so I think we have an obligation as veterinarians to continue to promote our profession, especially with the mental issues that people have had, whether they came from COVID or they were there before COVID and people are struggling. This is a profession where you can do what you love, you can have a great time, and you can help pets. And when we forget about those things and those important stories, I think that's when things are become difficult, and communication is so important. And when we can communicate simply, where the pet parents can understand, and that's what I try to do, is simplify it, make it as easy as possible. So for example, I'll go to my kids' school, I'll try to keep it as simple as that. When I say your pet's sick, we need to do these tests, this is why, and we'll go ahead and figure out what's going on.
Well, that's one thing that you said, and you led me right into my next question. You talk about, we can really enjoy this and have fun. When I was wanted to be a veterinarian in the early, I started when I was 6 years old. Let's go back to 1960. But here I am, getting into veterinary school in 1976, and everybody was like cheering me on. You made it. My God, you're the chosen one. You're going to love this thing. And it's gotten to where even recent graduates are like, I don't know, if I had to do it all over again, I don't think I would do it. And we've kind of got into a malaise. And in fact, I'm working on helping with a documentary called The Cost of Caring, looking at the mental health issues of veterinary medicine. But I think we need to balance that out with the joys of practice. Like you talked about, cracking the code on the one that's sick, the pet that shouldn't make it but does, the pet that's suffering from the recurrent skin problem that you fix. So I want you to speak to pre-vet students. I want you to speak to those people about why you still, because I know you do. I know you. I look at your posts. I know your wife, Jade. Every time I see Jade's diamond earrings, I'm going to know that it was recycled through Elvis. But speak to these pre-vet students out there. Why should they pursue this dream?
Yeah, because, if you have gone into this field because of your bond for pets, and that's your passion, you're going to continue being able to, feel not only your sense of accomplishment for helping that pet, which is, that you're doing the right thing for the pet, but you're going to form bonds with these pet parents that are lifelong. You're going to have relationships, you'll make friends through this field, whether, it's here, like I make friends with people that are local, but then I've made a lot of friends with people online that I haven't met in person. And social media has connected all of us. So before, we never had an opportunity to be like one-on-one with, for example, a cardiologist or an internist who was somewhere else on the other side of the country and see all the cases and share all the things. So we have so much more of an advantage to easily communicate and to learn from experts in whatever you're interested in. So I think the sky now is the limit as far as, if you want to specialize in something, other than general practice. There's so many opportunities to do things that just were never available before. And it's only gotten better, in my opinion. And yes, there's challenges of learning, the real life situation once you're out of school. But, mentorship is so important. And being supported by someone is so important. And that is more important than any other benefit or any other, fancy thing you might get offered. So that's what my advice would be, is make sure that, when you go to a practice, that you feel you spent enough time to really know what it's going to be like and if you're going to be supported as a new vet.
One of the benefits, I think, of Fear Free is when people think about being a veterinarian, they love pets and want to love and them to love them back. They want to help pets. And that's the great thing about Fear Free is you can love pets and they'll love you back because they don't fear going to the veterinary hospital, can actually have a great experience. All right, final question. Your dad's a physician, you're a veterinarian. My sister's a physician, I'm a veterinarian. Would you rather do a rectal on a human or on a dog?
I think that's a pretty easy question to answer.
That's one of the reasons why I didn't want to be a physician, but actually it was because the human patients complained all the time. We do these crazy surgeries on these dogs and they're running around with their tail wagging.
Yeah.
What a nice time to wrap this up.
That's a good way to wrap it up. Thank you, Christy. And thank you, Dr. Mann. And we'll make sure that we post your social media handles, how people can get a hold of you. And I really encourage you to follow him on social media. Thank you, Dr. Mann.
Thank you. It's been a pleasure talking to you.
Bye, everyone. Thank you so much for being with us today.